Hi, and welcome to Module 2, Lesson 3. On this lesson, I'm going to focus on obesity and how it relates to gut health. So let's get started. So obesity is a very complex health issue. It has many influences, such as medications, sugar, sweetened drinks, overeating, sedentary lifestyle, lack of sleep, genetics, smoking, gut hormones, and we'll get to a lot of that. But it's also has a very heterogeneous picture from a causality standpoint. We tend to gain more weight more easily as we age, women more than men. There's also, of course, obviously a big dietary factor, geographic factor, and it's very hormone and stress level dependent. Well, one thing that we can really conclude is that healthy gut is essential for weight loss to occur. So if you want to lose weight, you want to correct any gut health issues that you may have. And because the standard American diet, or SAD, is really a cause of low-grade systemic inflammation, it is a cause of many pro-inflammatory conditions, and obesity is one of those conditions. There's also an increased risk for autoimmune disease, insulin resistance, and dementia in the obese population. Now, the World Health Organization, or the WHO, defines obesity by body mass index, or BMI. Now, there's significant problems with measuring on using this as a scale for obesity, but basically it's weight in kilograms divided by the square of the height in meters. And anybody, according to the scale, anyone with a BMI over 30 is defined as obese. However, these have significant problems because the BMI was a calculation developed in the 19th century by a mathematician who had used subjects that were basically young European men in his calculation, and gradually over time, especially in the 20th century, it developed that BMI was being used as a scale for obesity, and it was never actually meant to be that. Now, the waist-hip ratio, or the ratio of waist circumference to hip circumference, is also used as a measurement of obesity, and it takes into account the amount of abdominal fat that a person has. And the higher the number for women and men, there's a difference in waist-hip ratio for men and for women. I'll get to that. But this has a higher, it can calculate the risk of potential health complications. So there was a study by someone called Youssef and others that were obesity to be redefined based on waist-hip ratio rather than BMI, the proportion of people who would be categorized as being at risk for heart attack would increase 3 times. And this has really been seen as a better predictor of cardiovascular disease than BMI. How do you measure the waist-hip ratio? Well, you look at the narrowest point of the waist and you divide by the widest point of the hips. So women with 0.85 waist-hip ratio and over have a higher health risk, and men with a waist-hip ratio of 1.0 and over. And these are two depictions of low, moderate, and high waist-hip ratios and the body shape associated with it. So women who have a low health risk usually have a pear shape. Women who have a moderate health risk are more avocado in shape. And the more high health risk is the apple shaped. And, you know, and this same scale is true for men. So I don't know much about whether you're shaped like a pear or an avocado or an apple, but the the waist hip ratio has been shown actually to just be a better measure for cardiovascular health risk in the population. So the microbiome is affected by obesity, and obesity is associated with or even caused by dysbiosis of the microbiome. There are some beneficial bacteria, such as Akkermansia, which is a beneficial bacteria that lives in um, people's microbiome who have a lower risk of obesity, and these bacteria may play a decisive role in reducing the burden of obesity via the modulation of glucose metabolism and low-grade inflammation. So, a relative abundance of Akkermansia is associated with a low risk of obesity, and the association thus also declines with aging. The other microbial ratio, which is the Firmicutes bacteroides, or the FB ratio, suggests that microbial imbalance related to increased caloric extraction from food, fat deposition, lipogenesis, impaired insulin sensitivity, and increased inflammation. So we can look at these two categories of uh, bacteria in the gut to look at the risk of obesity and um, how how the microbial imbalance is interpreted. So the hunger hormones, there's four of them. They're defined as hormones that are secreted by either by fat cells, stomach, adrenals, or pancreas, and they all regulate hunger, appetite, and blood sugar levels. So first you have leptin, which is secreted by the fat cells. It inhibits hunger and it regulates energy balance to maintain body weight. So if the more adipose tissue you have, the more leptin you have. However, leptin resistance is seen in obesity. So at some point, even though there is more leptin around, uh, the body is resistant. So the body does think it's starving, but it's actually not. So leptin is supposed to increase satiety. It's the satiety hormone, right? And so, however, if you're resistant to leptin, you're never going to be satisfied with food. So your body may think it's starving, but it's not. Now, ghrelin is secreted by stomach cells, right? And this increases appetite, promotes fat storage, and stimulates insulin secrete in release. So you see low levels of ghrelin in patients who have had gastric bypass, meaning they've been surgically manipulated to have less of a stomach, um, gastritis, or H. pylori infection. And high ghrelin is seen in cases of anorexia nervosa, IBD, and celiac disease. Now, cortisol is secreted by the adrenals. It counterbalances the effects of insulin to regulate blood sugar. So cortisol will raise blood sugar by releasing stored glucose. And insulin, finally, is secreted by the pancreas, and its job is to lower blood sugar by transporting glucose to the liver for storage. So insulin is the hormone which has the biggest influence on weight gain and metabolic disharmony. This is the hormone that promotes fat storage, and insulin resistance is highly common, and it's a big reason why folks can't lose weight. So excess body fat, especially abdominal body fat, is inflammatory. And fat cells trigger chemical messengers such as cytokines and hormones that induce and perpetuate inflammation. So, so the more fat cells you have, the more inflammation is induced. Further to that, fat cells enhance production of estrogen and increase risk of breast cancer and other estrogen-related cancers, such as cancers of the gynecologic tract, meaning the uterus, cervix, ovaries. Now, also, you also have high levels of leptin, as I said, in obese subjects, and leptin is the satiety hormone. However, obese subjects are less sensitive to the effect and therefore are less that are leptin resistant. So with the increase of inflammation and the leptin resistance, it also is more difficult to lose weight. And as you have seen from the last few lessons that I've gone over, that too much sugar reduces the beneficial bacteria and leads to a leaky gut syndrome. So you have, with the beneficial bacteria decreasing, you have an increase of pathogenic bacteria, or their opportunistic bacteria. And this leads to dysbiosis and a change in the internal mucosal barrier of the intestine. So some of the species that can overgrow are Enterobacteriaceae and Clostridium. These bacteria are sugar loving, so they grow. You have overgrowth of these species when someone is fed sugar, and it leads to a poor digestive health. And admittedly, it is very difficult to avoid refined sugars in the standard Western diet because you can find them in so many places. Now, this is just a cartoon which shows, not, it says for a high fat diet, but really what we're also talking about is not only high fat, but it's high sugar. And when you have an obese individual, this influences the hypothalamic pituitary adrenal axis, leading to dysfunction. It also leads to mitochondrial dysfunction, synaptic dysfunction, like between the nerves and effects. You have systemic inflammation, and you also have oxidative stress. And this leads to such kinds of disorders as depression, anxiety, cognitive decline, and PTSD. A lot of times we have we find people who go through a cycle of weight loss and post-loss weight gain, and this is known as yo-yo dieting. So yo-yo dieting is a very common problem, and it is very difficult to solve. And there has been some research over the past few years in mice that show that the microbiome changes in an obese individual, and it persists even after weight loss, and it accelerates weight gain after weight loss. So even if those mice lose weight, they still have the microbiome that will make them put the weight back on more quickly than if they never were obese to begin with. And researchers did find a way to disrupt the cycle by giving a compound called flavonoids to change their microbiome. So are there implications for us? It's still too early to tell, but for now, we have to just try the best we can with our, diet and lifestyle modifications. If you want to read more about obesity and the way we and the impact and influence of stress and inflammation on our bodies and as a cause of obesity, I would direct you to a few books. One is one of my favorites, which is by Dr. Robert Zembrowski, called Rebuild. The other book is by Michael Moss, who's an investigative reporter who wrote a great book called Salt, Sugar, Fat, which is about the obesity epidemic and our food supply. And there's another book that recently I read about stress and the connection between stress and inflammation, called Why Zebras Don't Get Ulcers by Robert Salposky. These are all great books to look up, and if you have any interest, there they are. If you'd like to contact me, you can contact me through my website at intentionalselfct.com, and you might want to find me on Facebook on my page, Intentional Self, and on my Instagram, Dr. Terry Alacio. And once again, this course is for educational purposes only, and it's not a substitute for medical advice. If you have concerns for your health or wish to be evaluated for any of the issues outlined throughout the course, please contact a healthcare professional. So thanks, and I will see you again in Module 3.